I don't get this done. Hey Ford, I recently asked you about the number one best test to avoid a heart attack, but you kind of went off a tangent and talked about a bunch of tests. I just want to know what to ask my doctor, or if I can just get an order myself. I don't get this done.
Yeah, you're not. You ask your doctor. You're not going to get the right testing usually. I mean, you'll get like maybe an A1C. At the end of the day, most doctors, as you and I both know, they're going to get an LDL, quote, bad cholesterol test, and you know where that's going. If you're not eating carbs, it can be sky high, and your doctor's going to have a conniption. That happens all the time. People are all the time coming to see us. And so the real best test gives you information on both your metabolic health, the root cause of cardiovascular inflammation, and cardiovascular inflammation. If you just test for cardiovascular inflammation, you may have the root cause going on, but not have the inflammation at this point. If you don't test for metabolic disease, you may miss both of them while you've got tissue damage happening in your arteries. So let me just give you a quick list. I mean, rather than go deeper down that logical bunny hole, let me just give you a quick list of some things to look at. Hs-CRP, high sensitivity C-reactive protein, that's made.
HC, high sensitivity C-reactive protein, which is a protein produced in the liver, and it indicates inflammation in a general way. This is the test we should do. I do always, and it should be less than 1 or 0.1%. Should be very low. If it is high, it means that there is inflammation. LDL is low density lipoprotein, which is one of the lipid panel. HDL, which is heavy density lipoprotein, triglyceride, and LDL. So we continue. So C-reactive protein is very important to indicate the inflammation and our metabolic health and cardiovascular health. It is part of the general health. And the important is the health of the lining of the blood vessel. And this is where COVID virus hit. In the lining of the blood vessel, it causes inflammation of the lining of the blood vessel and clotting and inflammation, because there are receptors in the lining of the blood vessel. And the lining of the blood vessel, there are cells which produce NO, nitric oxide, which increase the blood circulation and the blood flow. Okay, so we carry on.
Protein made by the liver, it's an inflammation test.
So this is the C-reactive protein.
It's not the be-all and end-all, but it's one of the best components. It should be, for most doctors that do test for inflammation, that's the test they use. Because of problems with biological false positives, I would also look at a couple of other tests. One of them is what we call LPPLA2. Another way of naming that is plaque2. That's what we call it. It's a test that shows inflammation is usually associated with high LDL. And it doesn't mean every time your LDL is high that you have inflammation, but it's a different test for inflammation. One of the most important ones, and the one that I like the most, is microalbumin creatinine ratio. It's a test that uses both urine and blood, and it looks to see, are you having problems with the endothelium, the lining of your artery walls? If you are, you need to know that. Other doctors have used that and looked at it. They really only understand it to be a test for kidney damage. It's a lot more than that.
So, I mean, the kidney damage, it is an indicator of general damage. You see, in medicine, we think in a reductionist way. We separate the kidney from the heart, from the brain. No. So people with, for example, a blockage of the coronary arteries, and they do surgery to open the coronary arteries. But what about the brain? After a few years, they will have bleeding in the brain. So it is general. It is not only in the heart. It's not only in the kidney. Okay, so this is very important, short video. And then this is which is very important for
my mental health.
If you are old, what he learned
These lessons took me years
for mental health. Of course, the people who walk with me, they are younger than me. They said we come to walk for our mental health. So walking is one of the mental health. Meditation is good for mental health. But this man, from his experience, he is going to tell us 5 things which he would not do for his mental health.
Need my peace for approval. Peace is the highest form of wealth.
You don't need
and
to
nothing
approval of
is
others.
worth losing it. 2. I will never walk beside people who do not walk beside me. When you carry a relationship alone, your spirit becomes exhausted. Energy must flow
Should
both
be
ways.
in and out.
3.
It's not only
I
one.
will never silence my heart when it asks to be heard. Your heart whispers before it screams. Ignoring those whispers is how you drift away from yourself. 4. I will never hold on to stories that no longer strengthen me. The past is a teacher, not a place to live. Let go of what no longer helps you grow. 5. I will never forget that healing is a daily practice.
It's a skill.
Transformation happens in small choices, small thoughts, gentle awareness. This is how you begin to become whole again. If you're ready to start your own healing journey, I created a 30-day healing journey to guide you step by step. You can join it through the link in my profile.
So for our mental health, we could walk, we could meditate, we could use the tool to reduce our stress. Of course, now I'm in the middle of washing dishes, but I came to the phone to listen and then I saw these short videos, so I thought I will share them with you about our mental health. So mental health exercises which increase the blood supply to the heart and to the brain, relaxation, any form of relaxation. Every person, the relaxation is different. Dancing, reading, listening to a religious book, or reading, enjoying. So I think this is a very nice educational video to help us in our mental health, psychological health, and spiritual health. And really honestly, I am very happy to read the cognitive behavioral therapy and translate it into Arabic with my Arabic subscriber, because I'm learning a lot. So I start to do things which I don't like to do. I say a small step every day, and then I am overcoming my old core belief, because it depends on the core belief you learn in childhood. My mother in childhood, she didn't teach me how to look after the house or to cook, but now I want to learn because things changed. So I am getting benefit from cognitive behavioral therapy. So everybody could use this to get better every day. It is a skill. It needs persistence. Thank you and goodbye.